On my 4th week at Prac at Sandgate Station, I was called to an RTC involving a cyclist and a truck. On arrival, the patient was prone position on the bitumen with blood pooling around her head. We rushed out of the ambulance to examine the patient and get a set of vitals. We rolled the patient onto her back, and we were able to see that she had partly degloved her face. However, doing a quick head to toe, she had no other injuries. Patient was GCS 3. Her sats were normal, pulse was normal. However, by looking at her, you could see she was diaphragmatic breathing, which means she was struggling to breathe. However, on auscultation, her lungs were clear. All other assessment could wait as my mentors wanted to move her off the road and onto the stretcher. We put a medium collar on her, and with the help from the fire brigade, we rolled her onto a scoop stretcher and put her onto a normal stretcher and put her in the ambulance. Once in the ambulance, we hooked her up to the Life Pack 12 to get a sight of vitals, and they were all normal. We could tell by looking at her, but that her body was compensating, and we didn't know how long that was going to last. In the ambulance, we did so much so fast that I'm not sure in what order this happened, but my mentor started to ventilate her, even though her sats were good, because we could see she was having trouble breathing, and her nose was concaving on every breath. We put an IV access in each arm, just in case we needed to administer drugs. I set up 2 fluid bags for the same purpose. We covered her degloved face to stop her bleeding. I checked her pupils, and they were normal. Her respirate, rhythm, and effort were slowly decompensating. Before long, the ICP and trauma truck person arrived and started to assess the patient. At this time, she was decerebrate posturing, which gave her a GCS 4. Sorry if some of the terminology is not quite correct, but I'm not quite sure what they did because it's a bit out of my scope of practice. Her abdomen was becoming distended as it filled up with oxygen, so the 2 ICPs consulted and gave her ketamine and rocamin, which are, to my knowledge, a pain relief and paralyzed and to relaxer. These were both flushed with fluids. Once she was paralyzed and relaxed, we were able to put an OP in her mouth, and they were able to put an orogastric tube into her stomach. They then proceeded to withdraw all the excess oxygen from her stomach, which made her flat again. The patient was stable, and the ICPs stayed on board and treated and transported her code 1 to hospital, while my other mentor and I hopped into the ICP's car and transported code 2. Even though the case was over and done with so fast, I believe that the important theme highlighted was to stay calm, and that to use your fight and flight adrenaline for good and not bad to treat the patient correctly. I'd never quite experienced anything remotely like this, where all my doubts about doing things just went out the window, and I just did everything that needed to be done. My mother is a theatre nurse and always tells me stories about in the operating theatre when something goes wrong, your body goes into autopilot. You need to stay calm no matter what and work out what the problem is and fix it. It is very important to find out early in your career, no matter what you do, how you react under high-pressure situations. If my mum or anyone else in the theatre got stressed out or felt they couldn't do it, someone's life could even be lost. She also says sometimes your best work gets done under high pressure because all your doubts go out the window and you just do what needs to be done. The fight or flight response is activated by cortisol going into the brain and slowing down the prefrontal lobe of your brain where the critical thinking gets done. Therefore, your body goes into autopilot. Once the cortisol in your brain, your hippocampus, where your learning and memory can be found, temporarily narrows. Due to your body's response to a stressful situation, you need to control how stressed you feel, because if you let a situation get the better of you, you will freeze. And how can you help someone in an emergency if you're frozen? An article by The Nest states that paramedics don't always have the time to go through and assess patients thoroughly. They must react quickly by isolating the injuries that are of immediate life threat. This is one of the great importance for paramedics, because if they don't do this, the patient might not live very long. For this reason, paramedics, healthcare workers, and any emergency services need to be trained to handle situations like this. They need to remain calm, cool, and collected, even if everyone around them is horrified. Once the job is done, it is vitally important that you can talk to your crew and debrief. If you're still a little bit emotional or feel a bit traumatized, it is important to talk to someone. I believe if my mentors, the ICPs, and even I had not stayed calm and systematically assessed the patient's injuries and their importance, the patient might not be with us today. Although it was a very confronting scene to witness on my 4th week on road, I am very grateful to have been there and helped the person that needed to be saved. I now also know how I react under pressure, and if that situation was to come up again, I would be able to handle it. We did everything correctly and by the book. The only thing the trauma track person said we could improve on is anyone involved in that kind of situation should always have a SAM sling put on as a precautionary measure. So at the end of the day, we learned how to handle ourselves in situations and how I could improve next time. I'm very glad that my mentors had a very positive outlook on me that gave me confidence. We also debriefed everything that happened, and I had numerous phone calls from people to ensure that I was alright. It is always good to know that there is people to help when I need them. Thank you.